Hello, my name is Dr. Joe Muscolino, and I am a manual therapy chiropractic physician in the state of Connecticut. And I am here with my Uncle Paul Muscolino, who has been a long-standing chiropractic physician. And we're here today to basically discuss all of your career up until now. So, Uncle Paul, can you please introduce yourself?
Paul Muscolino. Will probably need a few months for me to discuss everything, but I'll try to do it within a short time. I'm Dr. Paul Muscolino, chiropractor, practicing in Scarsdale now, and Manhattan, and in the past practicing in the Bronx.
And you have been practicing for how many years?
Since 1958.
So this is December of 2019. That means you've been practicing 61 years.
Correct.
Fabulous.
Yeah.
So why don't we start with what initially motivated you to become a chiropractic physician?
Okay, well, I was very original. I had two brothers, one an engineer and one a chiropractor. And so I started in engineering, went to City College for 2 or 3 years on engineering, and then I switched over to chiropractic, and I love both. And I see the connection because both are looking at structure, and that's what we do as manual therapists, chiropractors, etc. We're studying structure. So the engineering background really helped me to formulate my thinking in chiropractic as well.
You know, I'd like to add something in here. I never actually knew that. When I was younger, I wanted to be either an engineer or a chiropractor. And it was, when I entered 10th grade advanced algebra and trig, and I did not like math anymore, I said, okay, well, I can't be an engineer. I'll be a chiropractor. So we actually have a similar path there. But yes, engineering is about force application. Chiropractic, all forms of manual therapy are about introducing forces into the body. All manual and movement therapy are that way. So my Uncle Al, your older brother Al, was the chiropractor. When did he first enter the world of chiropractic?
Well, he graduated in 1951, and from him stems at least 7 chiropractors. Myself, my son, Joseph, my nephew, Dr. Demand's children, and on and on and on.
On the other side of the family, his two sons, my brother-in-law Sam. It all began at Aunt Judy out in California. It all began, and countless others that are second cousins.
Yes, probably near a dozen.
So it was Uncle Al that initially motivated you,
And of course, I'm the true Dr.
Yes,
Paul
you are the
Muscolino.
true Dr. Muscolino. So what chiropractic school did you attend?
Okay, I went to St. Louis, Logan College, I think mostly because my brother went there, and it was one of the outstanding, and still is, one of the outstanding chiropractic colleges in the United States. So I graduated in '58. I could add that I was always in a rush. I got through high school in 3 years, I got through chiropractic college in 3 years, and so forth. And it's as if I was always rushing to get somewhere. Now I look back and say, maybe I should have smelled the daisies or whatever, but I'm glad I did what I did.
Well, you got there 2 years sooner than you otherwise would have.
Would have.
So we would have said 59 years if not.
Right.
But now you've passed 60.
Yeah.
Can you recount any experiences from chiropractic school that are memorable? I can think of one you once told me, if you'd like to tell us that.
Give me a hint.
Something to do with the cadaver lab?
Oh, yes. Okay, I was always working in chiropractic school, so one of my jobs was to take care of the cadaver lab. We had one of the earliest labs. Today it's more commonplace, but back then, to work on cadavers was a little bit unique for chiropractic colleges. So because I took care of it, I would make sure the floors were very shiny. And it was easy to do because of some of the substances that wound up on the floor. But one of my motivations was, after everyone left, we would have games in there, and we would play shuffleboard. So and we play for dimes or quarters or whatever. So the shuffleboard court, which was between the different tables for cadavers, was our playpen. And I did enjoy not only the experience of going to chiropractic school, but I think the experience of being away from home. St. Louis, an interesting city at that time as well as now, and many other experiences. But
So we'll bring it back to academics.
Right.
So besides playing shuffleboard in the cadaver lab, you also went to your classes and learned academics. When you came out, you started practicing with your brother Al, right, in the Bronx?
Yeah,
Is that
actually, I had a separate practice, and that separate practice grew slowly. Then there came a time, unfortunately, when Uncle Al had a severe accident,
Car accident, yes.
and then I took over both practices, and for whatever reason, motivation or whatever, the practice just grew by leaps and bounds. We were seeing at one point maybe
Well, he was then back in practice after the accident. He healed, right?
shortly, not shortly. It took
Yeah.
quite a while, but the practice did grow. We were seeing like 100 patients a day, and
Very high volume.
yeah, high
So
volume.
what modalities did you use then?
Well, if I go back to Logan College, which is what we call the straight college for those who aren't in the profession, there are straight and mixers. The straight are the ones that abide by the philosophy of chiropractic and are very straight in that
Adjustment
area.
of the spine.
Just looking
not
to the
mixing in
spine.
other
Yeah.
Manual therapy or other
Exactly.
nutritional things. In the beginning, you started very straight.
Very
You
straight.
did change quite a bit over time, but then back then you were a straight chiropractor, and you were using any specific adjustment techniques?
Well, we were taught Logan Basic, which was
Sure.
a contact on the sacral area to kind of balance the spine. The theory being that if you correct the foundation, everything above it will be in better position. But as time evolved, I learned many other techniques. One of the techniques that I was happy to learn was the Mears technique, not well known. Dr. Mears practiced in New England, and when one of my sons was born with severe strabismus and his eye, sometimes you'd have to look twice to see if both eyes were there because it was so far over. And the Mears technique helped him, helped the strabismus, and really pretty much straightened
You
it out.
demonstrated a Mears technique in one
Yes.
of the LMCE videos we have.
Yes.
Right, I remember for upper cervical.
Yes, upper
Yeah.
cervical technique. And Mears was an engineer chiropractor, and he really applied engineering techniques to balancing the spine. One of the things I demonstrated, for which we got a fan mail, was adjusting the cervical area, breaking up the fixation in the atlas axis, and bringing the head back. Too often we have this forward head translation, which accounts for so many problems. And I demonstrated where bringing the head back allowed not only relaxation in the cervical area, but also helped the lower back and the gluteus muscle. So after the adjustment, if I measure it in fingers, approximately an inch each, it went from maybe 4 fingers to 10 fingers just after that one treatment.
In the ability, as I remember, of the thigh to extend, that the hip joint, the
Yeah,
change at
to
the lower body, hip joint, lumbosacral,
Yeah.
hip joint area.
Raise the leg all the way up,
Yes.
strengthening the gluteus muscle. And that's why the concept of just staying like a specialist in an area, I don't think is as fruitful as looking at the whole body and trying to do different things for different areas. One of the areas is the TMJ, temporomandibular joint.
Be careful if you touch the microphone; it will just make a little noise. So go ahead.
Oh.
Yeah.
because oftentimes the TMJ occupies more area in the homuncular nucleus of the brain than does the whole leg. So by fixing it, you can often correct many conditions, whether it's GI or musculoskeletal, low back, and so forth. I remember one patient who was literally passing out. She'd fall down sometimes several steps, and we found that the TMJ was the problem. Once we fixed it, she was fine. So looking at the whole body is so important.
There's an old saying, it's one of my favorite sayings. It goes, follow the person who seeks truth, beware of the person who has found it. I've never believed that any one technique will cure everybody of everything. So, and also there's an Instagram feed out there on the foot that has a great title, Top Down Bottom Up. It's actually called Gait Happens, but their saying is top down, bottom up, and I like that because they say they look from the top down, they look from the bottom up, and certainly the spine sits on the sacrum of the spine. The sacrum is part of the pelvis. If the pelvis changes its posture, the spine must change its posture.
Correct.
So I always like to joke and say, look thee to the pelvis. Right? But certainly there's all these approaches. So you came out, you began with Logan Basic, which was more of a looking from the sacroiliac joint. You then found Dr. Mears. Any other continuing education gurus, mentors that you kind of followed and learned from?
Well, I owe a lot to Dr. George Goodhart with his application of applied kinesiology. I think so many things stem from that. One of them was called the challenge, and I used that, and I think chiropractors, whether they know kinesiology or not, could learn from that. In other words,
so when you say kinesiology, you mean applied kinesiology, AK, the technique, yes, okay.
Yeah. So one of the things you could do is use the challenge to see whether there's a change. For instance, if the head is too far forward and you want to show that to the patient and test it for yourself, you could do a simple arm test, perhaps using your arm, bringing it down, and you'll see if the head is in the right position, everything's fine. But when you bring the head forward, almost like caveman style, then you could see how many weaknesses evolve. And after you make the correction, in this case, cervically bringing the atlas posteriorly so that you get a better balance, you could retest, re-challenge, and see the difference. And you could do that with so many areas. When you want to test the technique, just challenge it and see how it goes.
Yeah, so AK, applied kinesiology, is primarily a diagnostic technique to see how the body responds to a certain structure or movement, and then you choose your treatment to fit with that.
Yeah, and AK also introduces the concept of structure, biochemistry, and psychology, and how they interact with each other. So helping one side of a triangle is helping the other side.
So we're now widening out from straight chiropractic adjustment only, because I know you also got very involved in nutrition at a certain point.
Yeah, because your obligation, your first obligation, is not to the philosophy that you learned or the technique that you employ, but rather to the patient. So you have to ask yourself, what is the best I could do for this patient? And I think in those terms. Structurally, what can I do to correct the imbalance? Biochemically, what nutrients can I use to help the person? Psychologically as well as physically. So if a patient has a lot of stress, we'll use things like valerian root, passion flower, magnesium, B vitamins to help relax the individual. Niacin oftentimes helps, even in schizophrenia. And thirdly, looking at the person not only biochemically and structurally, but psychologically, and trying to employ all the methods necessary. So if that be true, and your obligation is to the patient, then it's incumbent upon you to learn more or to recommend to other practitioners who use those different techniques.
I like that. I like that very much. So many people become kind of a slave to their ideology instead of saying, let me open my mind, think outside of the box, pick and choose whatever will fit.
Yes.
And so I always thought, growing up, I mean, I've been a chiropractic physician now for 34 years, and it feels like nothing compared to 61.
You're still a kid.
I'm still a kid, that's right. I wish. Different levels of dinosaur,
Yeah,
right?
right.
I think we joked about that back on Christmas Eve.
Yeah, right.
You're Jurassic, I'm Cretaceous, whatever period it was. But I always remember and respecting tremendously, admiring tremendously, before I was in chiropractic school. When I was first out, you were always going to workshops and seminars for different techniques and different ways of learning things. I mean, you were the social butterfly of the chiropractic world, as I remember. If you were to kind of take a step back and look from 1958 to now, here we're what, just like 4 or 5 days short of 2020. Would you say there's any one major philosophy now that you have, or did you just state it with the idea of your imperative is to help the patient and to do that with different legs of the stool?
Exactly.
Yeah.
And when you kick out one leg, and let's use that triangle again, kick out one leg, the others collapse.
Right.
So if there's any change, it's thinking more holistically. Even when it comes to structure, whether you're doing chiropractic or some form of manual therapy, looking at the structure, knowing what is norm, and then trying to duplicate it with your patient. If the patient has forward head slant, you want to bring it back. If the patient's leaning toward one way, you want to try to balance it. If the pelvis is forward on one side, you want to try to bring it back, rather than looking at just a piece of the pie, a segment. So chiropractic, oftentimes, because we're manipulating different vertebrae, we look at the segments of the spine and we say, oh, I see, this patient has a sinus condition, therefore let me adjust the atlas axis. Or he has a sciatic, let me adjust the fifth lumbar. And that's perfectly all right. But look at other factors that could be involved in that area. Look at the nutritional need for, say, using things to help the sinuses, even a saline solution, cleaning out the nostrils, helping to prevent postnasal drip, could help many conditions. And going further, of course, you would get more sophisticated and use products like Congoplex from Standard Process Lab or some other products from DC, etc. So again, looking at the whole structure, I think, is the clue. And to further answer your question, you said, what other subjects? Well, I went to SOT for years.
Sacral
I would
occipital
go
technique,
with
which
Major
in the world of
Dijonet.
chiropractic is the name given to craniosacral technique, which a lot of people know by
As
that
cranios,
name.
yes.
Yeah, sure. Go ahead. Yeah, SOT.
So SOT, kinesiology, Mears technique, and further studies in extremity adjustment, etc. I try to get as much as I could, and I do believe that when people get to be fat cats, they get too satisfied, they sit back, and I think that's so wrong. You should always be looking for either new techniques or improving your technique or doing things to keep you inspired. The worst thing that can happen is complacency. So looking ahead, trying to do things that will inspire you is so important. And
You stole my second to last question here, and that was, what inspires or motivates you after 61 and a half years to continue moving forward?
Yes. Answer is number 5 on his crib sheet. So I think that sort of encapsulates what I feel is always keeping up to things, not getting complacent, not getting too satisfied, counseling sometimes the patient, and you don't have to be a psychologist. One of the things I use is temporal tap, and I think we displayed it on one of the sessions that we had. Yeah, where you tap along the STS line, temporal sphenoidal line, and we find that if we give a positive suggestion while doing that, the body absorbs it better. Otherwise, you say to a patient, do this, do that, and it goes in one ear and out the other. The compliance with even exercise is something like 20%. But if you tap it in using applied kinesiology technique called temporal tap, you can often get better results because the patient adheres to that suggestion, almost not quite post-hypnotic suggestion, but a suggestive type of therapy. And to employ it, to show the patient that it works, I'll often say to the patient, your left arm is weak. And I'll test it. Of course, it's not weak. And I'll say, and I'll use the Sicilian horns, your left arm is weak. And it doesn't go weak. But
you
then
would think that would work.
Yeah. It works on mafia people.
It works on mafia people.
But then if we use, and I could almost display it, this temporal technique, why don't we do it right now? And I'll say to you, your left arm is weak. I didn't test it beforehand. Your left arm is weak. Joseph, your left arm is weak. Now be honest. Let's bring it up. Hold it up, and it's weak. And if I say your left arm is strong, your left arm is strong, your left arm is strong, immediately it's super strong. So it sounds almost like voodoo. And when I first saw this in 1970s, I literally left the assembly hall because I thought, this is too far out. But as time went on, I learned that it really works, and a lot of those techniques work, and they just enhance the treatment, because now what you're delivering to the patient is concepts as well as manipulation. The best concept I could think of off the top of my head was one of Parker axioms. Parker was a PR teacher in Texas.
Practice management.
Yeah. And what he one of his theories or axioms was FCB in your PSI. And what it stands for is having faith, confidence, and belief in your person, your service, your ideas. And often, or too often really, our patients don't have a good self-image, and they're more prone to be stressed out. And stress is the silent killer. It kills all of the things we're trying to achieve. So trying to give the patient more FCB in their PSI, more self-confidence and so forth, goes a long way toward helping them heal.
You know, you might have already, in effect, addressed it because you spoke about what inspires you and what you look to do, but are there any other words you would look to give for someone who is either graduating and coming out of chiropractic college today, or any manual therapy or movement therapy field today?
Well,
or any health-oriented field?
Yeah. Well, I think the idea of putting the patient first is the most important, because they feel it, they know it. I was like so elated, and I'm not working for tips, but I got a $200 tip yesterday in the office, and last week another $200 tip, and it was.
We'll put an address on the screen that you can send money to. I assume these are Christmas gifts in some way.
Yes,
thank you.
One letter, it was so nice of this patient. She said, I so appreciate the fact that you really take the time to study and look into everything for me, et cetera, et cetera. And, you know, and it was just so self-fulfilling. You know, we get paid for our services, but it's the appreciation that allows us to really prosper in our field. And it's the appreciation that keeps people going. Otherwise, I think I would have followed my theory years ago. When I'm 55, I'm going to retire. Well, here I'm 83 and still going. So it's appreciation. And how do you get appreciation? By doing the best job you can with your patients, looking at each area that you could improve and trying to be the stopgap for improvement.
There's an old saying, I think, that captures that too. It's people don't care how much you know until they know how much you care. So,
yeah.
Uncle Paul, thank you so much for
I
all
think
the
I wrote that.
inspiration. Yeah, you wrote that too?
Thank you for the interview.
Thank you.
Appreciate it.